For more than 20 years, CTV has captured the moments that matter in our community. From our studios in St. Clair, you're watching Focus with Paul Dingeman.
Welcome to another edition of the Focus program. Glad to have you along. Got some very interesting information for you today. Some surprises at the end of the show about a couple things that are coming up. But let's begin with a friend by the name of Dr. H. Lee Bacheldor, the Chief Medical Officer of Ascension River District Hospital. Nice to see you, sir. Welcome to the show.
Thank you. Thanks for having me back again.
So much conversation everywhere we turn about our famous COVID-19, and I thought it was important that you come in and just give us a sort of an overview of where we're at, what's going to be expected, what's going to happen with vaccines, et cetera, et cetera. The floor is yours.
Thanks. So we are certainly in a second phase of our pandemic, much like we had back in March and April. We're hoping that we're seeing a little plateau. We're not sure, but we're seeing a little flattening in the state. But also we're anticipating the post-Thanksgiving uptick.
Yep.
People got together for Thanksgiving in spite of advice not to do that. So we're thinking that there may be a little uptick here. All of our hospitals are busy. We're seeing a lot of coronavirus patients. We're not seeing the severity of illness we saw before. We are seeing some unfortunate deaths, and we grieve for those folks. But we're seeing folks that are getting a little lesser illness. We're not using vents as much as we did before. We're not putting the call out throughout the state and the country to bring ventilators to us. We're treating more folks with oxygen, and we have some more medications, remdesivir, which is a medication that we have at our disposal. We use zinc, we use vitamin D, we use steroids to quiet down the inflammation. So we're making some progress with the disease, but it's still out there. A lot of folks are becoming positive. We're seeing a lot of mild disease, which kind of worries me. This isn't anybody else, but this is Lee Bacheldor, that people get mild disease, and so they're going to say, so it's a little bug. I'm going to go out, and if I get exposed, I get exposed. But we are seeing folks that have, got the disease, they got ill, they were ill 3 months ago. They're still having symptoms. They're still fatigued. At 3 o'clock in the afternoon, they just run out of gas and got to go home and take a nap. They just can't do anymore.
How do I know that it's mild?
Well, you get a little ache. Some of the folks are saying, I feel like I just got a sinus infection. That's what they're feeling like. And so, they get tested and they're positive. And so then, their spouses get positive too, and so they're quarantined. And so,
right.
That puts people out of the workforce for 10 to 14 days. And also, the potential to infect grandma, grandpa, and everybody else they come in contact with too. So it's out there. We need to still be diligent. Vaccines, and as Dr. Fauci and the coronavirus task force tell us, help is on the way, the cavalry's on the way, but we still got to keep fighting.
Right. So we have to be cautious as individuals. If we got a chest pain, if we got a pain in our arm, if we got a pain in our leg, do we compare that to COVID, or do we just stay away from it, or should we run to the emergency room, or?
Well, we really encourage people to go to the emergency room, and there are some new ads coming out across the state to make sure that we don't delay treatment, because we saw during the first pandemic, or the first uptick in our pandemic, people were staying home, having heart attacks at home.
Right.
We're seeing a lot of deaths not related to COVID, having strokes at home and not going to the hospital. Hospitals are probably the safest places for people right now. We screen everybody that comes in the door. We screen their temperature. We have certain questions that we ask them. People that get admitted to the hospital, we test everybody that gets admitted to the hospital. And then when they come in with the coronavirus-related illness, we have special areas sequestered off from the other areas of the hospital where we put those folks and treat those folks. So it is safe to go, and we certainly don't want people to delay care and not go to the hospital.
Approvals of the vaccines are coming. Canada has approved one already. Other countries have approved one. The United States will be right there in a day or two.
Yep. Pfizer will be coming, Moderna right on its heels, and probably a Johnson & Johnson one after that. We're all of us healthcare entities are getting our processes in place and setting up, how we're going to receive it, how we're going to maintain it, how we're going to distribute it, how we're going to vaccinate. We all have lists of who we're going to vaccinate first, and it's usually the healthcare workers that are exposed to patients that have coronavirus.
Right, as it should be.
And the people in long-term care are, congregated facilities, and then the elderly, and then we go down the line. But it's going to be a little while before we get everybody vaccinated.
Probably spring or late summer, or late spring, early summer.
Correct.
Would be a common
Yep.
answer for that.
Yeah. Yep.
Okay.
We also have some new tools. We have a new antibody, bamlivimab. If I'm saying it correctly, we call it BAM. If you say it real fast, it's
Yeah.
you stumble over it. But it is an antibody that is helping fight mild disease, and its role is to keep people out of the hospital. So if we see someone who is at high risk, so if you have emphysema, diabetes, obesity, you're older, and if you have a test, and within 5 days of that positive test, we can get you in an infusion center and give you an infusion of this antibody and hopefully prevent deterioration and hospitalization.
Wow.
It's new. It's just coming out. We just set up a facility down at St. John Hospital and Medical Center. It requires a lot of legwork, a lot of intensive work to get it set up. The infusion takes an hour, and you have to be monitored for an hour afterwards.
So it's not a pill.
It's not a pill, it's an infusion, and we've just started doing a few folks. In the county up here in St. Clair, there is discussions just this afternoon on how we're going to try and see if we can do this in the community and get that out there and start hopefully treating people when they have mild disease before they deteriorate and end up in a hospital on a ventilator or on high flow oxygen and severely ill.
Well, we're so lucky that we've got Ascension River District Hospital right in our doorstep, and your staff has been working on this for forever.
Yeah.
So.
Staff's getting tired, I can tell you. They're really getting tired, and they're working. We're working hard, and all the hospitals are. I mean, all of them. Lake Huron Medical Center, McLaren, our Ascension hospitals are all getting taxed and feeling the effects of this second wave.
One of the people from Ascension gave me a call the other day about a program that you've had for a long time, which is called Community Care Link, and they got a lot of wonderful workshops and things that are happening. We're going to talk to them the first part of the year and maybe get some people back into some normalcy about health care for themselves. Stop worrying just about COVID. Yeah.
Hopefully when we get back to normalcy of some sort. Cynthia Tagg, who is our community health person at the system level, has done a lot of great work. She has folks that we have community health centers in schools in Detroit, Macomb, and Oakland County, Wayne, Oakland, and Macomb County, trying to improve the health of kids. We have programs for seniors. They had a balance program that they put on here at River District Hospital for seniors to improve their balance and reduce their risk of falls.
Okay.
So they have a lot of great programs coming out. Once we get over this and we can start congregating a little bit, we'll put those in place.
Well, thank you for your time. I know you're extremely busy, and I just thought it was important for the public to hear from you and know that Ascension River District is at the doorstep and ready to help.
Good. And just one parting thought, if you feel ill, if you're feeling chest pain, you think you're having a stroke, don't be afraid to go to the hospital. We are probably one of the safest places to be.
Good advice.
Okay.
I'll keep that in mind.
Thank you, Paul.
We're back with the new mayor of the city of Marine City, Cheryl Vercammen, is along, and she's got some great stories about what's happening down there with a young fellow by the name of Santa Claus. We'll be right back. Well, exciting things are happening in the city of Marine City. They had a special visitor come to town, and he drove all over town to see all the good little boys and girls. What was that all about, Miss Mayor?
We decided to do something a little different this year because we couldn't have the parade.
Right.
So instead of the people coming to Santa, Santa went to the people.
Wait, what are you talking about? Tell me about
Well,
that.
we did it on the same day of the parade.
Okay.
Which was Tuesday,
The second.
December 1st.
Yeah,
No,
first.
Yeah, the 1st. And we put Santa in the back of a pickup truck all decorated, and we had a DPW truck all decorated. We had a police escort with the sirens. We had somebody that loaned us his PA system. We had music, and Santa was on a mic, was able to talk to the kids.
Marvelous.
And we went up and down, I'm going to say 99% of the streets.
You're
We
kidding.
did miss a couple, but it was phenomenal. It was phenomenal.
What time did you start?
We started at 6 o'clock. Our hopes was to be done in 2 hours, you know, and it ended up going into 3, a little bit more. But the thing that I loved the most about it was when we started the route, right? People were just coming out of their homes, and kids were standing on the corners, jumping up and down. It's really him! It's really him! And it was great. It was absolutely great.
So you drove Santa with an escort on every street in Marine City.
We tried.
Great idea.
Yeah,
it was your idea, wasn't it?
Yeah.
Well, congratulations.
Thank you. You know, our goal was to hit every street.
Yeah.
You know, and we did miss just a couple. You know, next year we all kind of came as a collective group after we finished, and we all said, "Oh my God, that went so well." The thing that really touched me was even some of our older residents, you know, came to their windows and were waving at us from the windows and mouthing "Merry Christmas." It brought a tear to my eye.
You know, we've all struggled through COVID. It's a terrible, terrible thing that's happened. Thousands of people have died in the state of Michigan. But this sort of developed an idea because of that, right? Because we could not have a parade.
Right.
So you took an idea and ran with it. It's just marvelous.
Yeah, yeah. In fact, I wanted to, I brought a prop.
Uh-oh.
So I borrowed this from Santa.
Oh, my.
This was just some.
Oh.
You know, I mean, these kids came to us and
Look at these.
We had some woman brought
All
us
the
hot
letters
chocolate.
from Santa?
Yeah, I mean, hot chocolate, cookies and milk. I mean, all the letters, and it was phenomenal. In fact, I've already given a lot of these back to the parents because they're calling, going, "I didn't get a chance to see my child's note. Can I come pick it up?"
Before we get it to Santa. Well, we got to get these. We're going to get these back to you.
Yeah.
Because we know you got to get them up to the North Pole.
That's exactly
Look
right.
at this one. This is one of them here. They're just wonderful, wonderful letters.
Look at the cursive, trying to do the cursive. You know,
That's great stuff.
oh my goodness! Some kids drew Santa pictures, and I mean, yeah, it was just phenomenal.
Well,
phenomenal.
It's amazing what happens when necessity makes us do things, and it just worked out.
Yep, it worked out.
I better put your sign up first, and tell the people who we've been talking to.
Right.
The new mayor of the city of Marine City, Cheryl Vercammen. You've been on the city commission for a number of years.
Just a couple. Yep.
Couple of years.
Yep.
And the vacancy became available when Mr.
Bannon
Bosch went up to the county to run that.
Yep.
And so I salute you. It's not an easy thing. People think, oh, they're the mayor. It's a lot of work.
It can be. Depends on what you put into it. You know, I have things I'd like to accomplish in 2 years. You know, it's a 2-year gig, so. You know, I always tell everybody, I told the city manager, I said, hang on to your hat, we're going for a ride. So. Well,
you came to me and we discussed it. You thought you'd like to be able to have a little more communication with the people. So after the first of the year, in fact, we're getting some equipment in as you and I speak into the studio here, and we're going to build a new set for government communication. And you're going to have a show once a month.
Once a month,
and talk about what's going on in Marine City, what's coming up in Marine City.
Right.
2021 is going to be a great year because it's got anything is better than what we've been through. But you've got a lot of stuff on the agenda there in Marine City.
You know, I'm going to call it the Mayor Minute, even though it's not going to be a minute.
Okay.
You know,
right.
But the Mayor several minutes doesn't really have a good ring to it. So call it the Mayor Minute and just talk about different subjects. You know, my first subject in January is going to be about volunteerism.
Okay.
And how important it is to, you know, step up and get involved in your community and any level. It could be the schools and city government, whatever. But the importance of that and to show our children that, you know, volunteering is a good thing.
Yep.
Yeah.
Okay. Well, we'll get the dates and times for the show all organized as we go along here. But we salute you for coming up with that idea, and especially for this idea. It makes a lot of people happy. So.
Yeah, it was a great outpouring.
Well, we didn't want to take a lot of your time today. We know you got a busy schedule, so thanks for coming in.
Thank you.
And Merry Christmas to you.
Merry Christmas, absolutely. Thank you for having me.
We'll be right back. Well, that about wraps it up this show. I got a couple more things lined up for you here. Wanted to tell you that Cheryl Vercammen is doing a great job as the new mayor in Marine City, and Dr. Bacheldor. I want to thank them both for showing up today and helping us. What we're going to show you right now is a song from the Marine City Treble Choir and Chorale, which was a virtual concert which was orchestrated by their music director Bert Van Dyke and Dave Simpson, the manager of the Performing Arts Center on East China on Meisner Road there, put it all together painstakingly, put 35 different tracks of music and people together, and this is what came out.
How many roads must a man walk down before you call him a man? How many seas must a white dove sail before she sleeps in the sand? How many times must the cannonballs fly before they're forever banned? The answer, my friend, is blowing in the wind. The answer is blowing in the wind. How many years can a mountain exist before it's washed to the sea? How many years can some people exist before they're allowed to be free? How many times can a man turn his head, pretending he just doesn't see? The answer, my friend, is blowing in the wind. The answer is blowing in the wind. How many times must a man look up before he can see the sky? How many years must one man have before he can hear people cry? How many deaths will it take till he knows that too many people have died? The answer, my friend, is blowing in the wind. The answer is blowing in the wind. The answer, my friend, is blowing in the wind. The answer is blowing in the
Blowing in the Wind with the Treble Choir and the Chorale from Marine City High School. Salute to Bert Van Dyke, who got it all organized, and to Dave Simpson at the Performing Arts Center, who put it together. So just want to give you a heads up for the next couple weeks. We'll be reviewing a lot of the Christmas programs and pageants that we have had on Channel 6 over the last couple of years. Shelley Selecki is a music teacher in the north part of the district and has put together some great programs over the last numbers of years. We're going to reprise a number of those. Also the concerts from St. Clair High School and Marine City High School choirs and bands. All the Christmas shows that we can find, we'll stack them all up and play them for the next couple weeks, and hopefully you enjoy them. That's about it for today's show. We thank you very much for tuning in, and stay tuned to CTV for all of your Christmas music. See you soon.
Thanks for watching Focus with Paul Dingeman. Focus is produced at the CTV Community Television Studios in St. Clair. For over 20 years, CTV has captured the moments that matter to our community.